Hi, Paul Coker here from onebloodydrop.com. I'm really excited today. I'm here with Dr. Rob Andrews, who's an expert on diabetes and exercise. And Dr. Andrews is going to share with us some of his knowledge in this video about how to prepare your diabetes before you do aerobic exercise. So, Rob, thanks for joining us today.
It's all right. Thank you for inviting me.
Fantastic of you to be here and sharing your knowledge. So can you just give us an introduction of who you are, because I couldn't do you justice. I've read through your CV and I think that your introduction will be better than mine.
So I'm Rob Andrews. I'm a physician. I work at Taunton, which is a local district hospital where I take care of the average person with diabetes, mainly people with type 1 diabetes. But there I run a specialist clinic where people come from all around the country to get advice about what to do if they're exercising, that be it going for something they've never done before, like an Ironman or a marathon, or if they're exercising at the elite level. And to add to that, at the University of Exeter, we try and do research to back up that advice that we give them. So we do lots of research as to how to get the advice right.
Excellent, thank you. And what I'd really like you to share with us today is something about the underlying physiology, because many of us with type 1 diabetes learn how to exercise through a basis of trial and error and having one disaster after another. And whilst there may be some value in that, it's not necessarily very safe. And I think with a little understanding of the physiology that's happening in the different exercise modes, I think that we can actually start to make decisions that are based on information, which means that we can then start to judge what we need to do. So can we talk about what you need to do before you do aerobic exercise? Now, for anybody that doesn't know, what is aerobic exercise?
So aerobic exercise is the type of exercise that you are doing that uses oxygen all of the time, and the oxygen that you take up matches how much oxygen you need for the exercise. So what that means is that you're always burning your fuel completely, rather than partially burning it. So you're at the optimum performance that you can be in terms of the fuels that you're burning. But what that means is that because you're at that level, you can't do it at a really, really high intensity. So most people that are doing aerobic exercise are doing something that they can do for at least 4 or 5 minutes, but generally are doing it for over 30 minutes.
So that would include things like rowing and cycling and running.
Yeah,
for example.
Yeah, so anything that you do, you're doing continuously and repetitively that's longer than a minute or so is aerobic exercise.
Okay, so for people with type 1 diabetes, what special measures might they need to take before they partake in aerobic exercise?
So the key thing for really any form of exercise prior is to make sure you know what your blood sugar is and the direction of travel that the blood sugar is going. So we try and recommend to patients that before they exercise, if they can, that they get at least 2 blood sugars separated by at least 15 to 20 minutes, so they can see whether the blood sugar is fairly steady, or whether it's going up, or whether it's going down. And what we know for the majority of people, but people have to learn how an exercise affects them, but for the majority of people who do aerobic exercise, is they'll see a fall in the glucose across the event or the exercise. And surprisingly, I think what always catches people out is that low intensity, so gardening things or walking, are the things that tend to lower the glucose the most, as opposed to things that they're doing at high intensity. And the reason for that is that as the intensity of the exercise goes up, your body naturally produces hormones that protect you from the glucose going down by causing your liver to produce more glucose. Well, when you're doing something that's quite low intensity, you don't see that as a stress, so you don't produce those hormones. So what happens is the muscles ask for the glucose, and most of that glucose comes from the blood, so your glucose can fall quicker. So what we like them to do is check what level that they're at, and we tend to give them a target and say if it's not above a certain amount, and the figure we tend to start people on is 7. If it's not above 7 or around 7, that you might want to take something before you start to make sure that you don't fall too far and get to the 4, which obviously is the floor.
Yeah. Okay. So should we be looking at carbohydrate loading in the hours and days leading up to aerobic exercise, and should we be looking at insulin reductions?
So there are three ways of managing an event in terms of the glucose, and we like to say to people that in other things to prevent injury, you use ice, and that's the analogy that we use. So you can either change your insulin, so the I, you can take carbohydrate, or you can think about what you're doing with the exercise. So those are the three things that you can think about. So if you're from the insulin point of view, you can reduce the amount of insulin if you know you're going to exercise within that part of the fast-acting insulin. So if you're going to exercise within 2 hours of a meal, what you can do is you can reduce the amount of insulin you would have taken with the meal. So there's less around when you're exercising, so you have less risk of it falling. And the carbohydrate that's not taken up by the insulin, because you've reduced it, will be eaten up during the exercise, so you have a chance of it being flat or just falling slowly. And we start off with a rule of saying try 50%.
Yeah.
And then adapt it depending on the response that you get. And that's the other thing that's really important about when you're exercising, is the record keeping. Keeping a real clear record, going back and looking at what happened from that point of view. If you want to use, if you feel you can't do that because it's not planned, and it's very difficult to plan and know that in an hour and a half you're going to do exercise, most people have to fit it into their daily life, then you're left with the option you can't change your fast-acting insulin because you didn't know what was going to happen, and then you're left with the C, the carbohydrate. So what you can do is if it's below 7, you take a small amount of carbohydrate, and what we generally say is start with 15 grams, and then if you take 15 grams for every 30 minutes of exercise that you do. So you take it at the beginning and then at 30 minutes later, and then go back and adapt. If you find that the blood sugar is above 7, then you know for that first 30 minutes you're going to be okay, and then at that 30-minute point take the 15 grams.
Okay, that's really good and useful advice. And for patients who are using multiple daily injections, they obviously have very limited ability to change their long-acting insulin, but for patients on an insulin pump, would they consider reducing their basal rates? Would that be a recommendation?
Yeah, so you can, so people on the pump, so just for those people who aren't on pumps, so pumps are a way of continuously giving insulin through a little kit that sits under the skin.
In fact, I can show you here.
Got one.
I'm wearing
Brilliant.
one.
Okay. And what you can do with that is that you can do much sort of what people who don't have diabetes do, is you can give a little background of insulin that's there all the time, and then you give through the device, you can give a little peak of insulin when you have each meals. Again, with exercise, there's two ways of thinking about that. If you are still exercising around the meal time on a pump, then the main thing to do is think about changing the bolus, so that peak, because actually changing the background is going to be swamped by that bolus. So actually, if you're exercising within 2 hours of a meal, changing the background isn't really going to make very much difference. It's thinking about changing the bolus. If you're exercising outside of the meal, then changing the background will make a difference. Ideally, we would like you to stop it as far before as you can. Ideally, at 90 minutes is that you would reduce the rate. But if it's only an hour, then that's good enough. And we again say try 50% to start with. If you find that you just can't do that, then there is evidence out there that as soon as you know you're going to start, drop it by 80%. Keep it that for the length of the event, and then put it back up again, and that's the safest way of doing it.
Okay, that's really good, and actually it's consistent with what I've found through my own experiences of running and doing hill walking, that the basal reduction is only very, very useful if you do it 60 to 90 minutes beforehand. And actually most people that I've met in my journey have asked me questions about why their blood glucose levels are crashing. It's because they've given too much insulin in the meal before they've exercised. And it's something I've been guilty of myself. It's something I've seen other people do, and I think that we can't underestimate how important that is.
Yeah, and I think you've hit the nail on the head. The prime problem that people with diabetes have in the exercise is that they have much more insulin around than individuals who don't have diabetes.
Excellent. Thanks, Dr. Andrews. That was really useful advice. In the next video, Dr. Andrews is going to be sharing with us what you should, or strategies that you can use for managing your diabetes during aerobic exercise. And as you've already seen, Dr. Andrews is just a phenomenal expert with a wealth of information. And join us on the next video to learn how to manage your diabetes while you're exercising.